All right, good morning, good afternoon, or good evening to everyone, wherever you are. Welcome to our HDC webinar of April. Today's session will present the GIZ-led Digital Pandemic Preparedness Assessment, which has been conducted in 5 countries in West Africa in 21 and 22. We'll begin by briefly presenting the assessment process and some of the challenges faced and lessons learned. And based on this experience, a digital health convergence cycle is being developed and some of the key perspectives will be shared. So at the end of this presentations, an interactive Q&A may follow if you have questions, and feel free to pop them in the Q&A box and in the webinar screen. So our guest speakers today are Barakisa, she's lead technical advisor at GIZ. We also have with us today Ernesto, who's technical advisor at GIZ, and who will be facilitating and moderating this session. And we have Peter, he's consultant at African Union on digital health strategy for Africa, but they can't really present themselves a little bit more. And you have their bios in the background materials that were shared. So before we start, please note that this webinar is being recorded and that we would like to make this recording available via our HDC website for the benefit of those who couldn't join us today. I'll now give the floor to Ernesto, who has kindly agreed to facilitate this session. Ernesto, over to you. Thanks.
Thank you very much, Carolina, and good morning, good afternoon, and good evening to everybody who's joining in. We're very glad and happy to share with you our experiences and lessons learned that we gathered throughout the digital pandemic preparedness assessments that we conducted in 5 different West African countries. Yes, in these times of great technological challenges and changes that will shape our societies for generations to come, forums like these or like this one are needed to approach a digital transformation of health systems in a solution-oriented way. And yes, mentioned, we want to present to you and showcase to you the I'm going to correct the title a bit because we discussed it in the team. The digital health system cycle, not a life cycle, because the life cycle ends with the life, but we want to have a continued cycle to assess the digital health system in countries. And this one, as mentioned, was developed as a continuation of the digital pandemic preparedness assessment that we did in these countries. And the digital health system cycle is meant to describe a whole system development cycle from a country perspective. And as previously mentioned in our conversation already with some colleagues in the country engagement group of the HDC, we believe that the HDC provides an excellent platform to introduce the system in countries. Without any delay, I would like to hand over then to my colleague Barakisa and Peter to give us now, to introduce us the digital health cycle system. And Barakisa will start now to give you an overview of the HDC context and also the digital pandemic assessment development. And afterwards, Peter will introduce you to the digital health system cycle itself. So without further ado, I hand over to them and for Barakisa for the first part of the presentation. Thank you very much.
Thank you, Ernesto. Can you see my screen?
I don't see it yet.
I think the audience can see it. Caroline, can you tell me whether it's okay? You can all see the screen, right?
We see that you've started to share your screen, but I don't see a content.
Okay, let me.
Maybe if you stop and try again.
Okay.
Have to select a specific window that you'd like to share.
Can you see my screen? Sorry, this shouldn't have happened. Can you see it now?
No. Ernesto, do you have her slides deck? Maybe Ernesto can then. Can then share on your behalf.
Yeah, I think Ernesto should.
We can see the screen now via Ernesto, I believe.
Okay. I think it's my screen, right? Can I start now?
Yeah, sure. We do see the slides on the screen. So
Okay.
it says agenda, introductions. Yeah, go ahead.
As Ernesto already introduced the agenda, I will keep it short. We will start setting the scene. We had already the introduction done by Ernesto, and we will start with the setting the scene. What is HDC for us? Why are we doing this presentation in this SDC platform? And also going through the evolution of the DPPA, so how the assessment that we conducted, how it's evolved, and to at the end of the presentation, I will give at the end of my presentation, I will give the mic to Peter to take us through the digital health assessment cycle. So, and after that, we will open up the conversation and get a short round of discussion. And okay, that's setting the scene for the HDC. What does it mean? So we needed to see to first of all define the HDC for us. So we see the HDC as a platform where topics, issues around fragmentation are addressed, and how multilateral stakeholders are working together to avoid silo implementation. And from our understanding, the HDC is a platform that offers all partners or institutions that are willing to address these fragmentation topics with the partner countries to be able to address that together in a well coordinated way. So what I mean, this definition, we took it from the HDC website. The HDC work with these three instruments: the working groups, which as Ernesto mentioned before, are also one instrument that we definitely see as a very valuable set of topics that are being discussed or addressed in the working groups. And we are actually, as a GIZ program, we are actually involved in many of these working groups. And this digital health system cycle is being discussed in the country engagement working group. And so we in this working group, we identify the topic as very relevant to be discussed also in the wider HDC working group. The second instrument that the HDC is promoting for, and which we are happily also aligning with, is the Knowledge Hub. The Knowledge Hub is supposed to be the platform which is promoting standards and toolkits that can be used at country level to implement digital health systems. And what we also see as a valuable instrument at HDC is the range of partners that HDC is working with or engaging in, not only countries, but these institution networks and single consultants that are part of the HDC network is really a very good platform. So the working group, I don't think that we have all the working group listed here, but this is actually the digital health and interoperability group is being one of the working group where we have been discussing this the assessment and the results and the evolution of the methodology that we are presenting here. And the knowledge hub, as far as I have been following on, is promoting several standards and guidelines that are supposed to support the country ecosystem towards implementing less fragmented solution to be included in the national health system. I mentioned before the range of diverse partner that the HDC is involving and is engaging with, and we see that all those partners are converging towards one goal, which is the national health platform, national health plan, sorry. And as such, this is what we also see as the more relevant aspect to be that should be leveraged when developing a digital health system.
Berekisa, sorry
yes.
to interrupt you, but I see some comments on the chat saying that they can still see the screen. Even though I can, I believe you can too. I think it's Ernesto sharing. Maybe we should just try to reboot one more time.
Sure, I can reshare it then. Just one moment.
There is a hand up from Rennie Dot from CDC. I don't know if she has something to say about this specifically, which seemed the case as the hand is no longer up.
I am at size at page 5. Sorry. Can you?
Okay, I can, but I hope the participants can. Yeah, okay. Participants say that they logged out and back in, and it seems to work okay now. Thank you so much. Please continue.
Okay, so I hope that you were able to follow. So currently, okay, I was describing the country, the partner that are being engaged by the HDC in their work. So as I said, the diverse range of partners that are being involved in the HDC work are all converging towards one goal, which is supporting countries, partner countries, to in the development of their national health plan. And I mean, in some of the working group, we've been discussing what it means, what country engagement means, and there have been many definition on the country engagement question, and currently we are going to discuss it maybe at the end. And okay. And these are basically the two questions that are being that are relevant when partners are engaging with the country. How can they support towards implementing national health plans, and then how to respond to the challenges and opportunities that are emerging in the countries. So this is the background against which we are coming in this call. You can go to the next, please. So, and as country, as we identify also country-led countries, national health plan to be the main goal for us, we also looked at the digital, the DIG. I mean, the WHO has set up a platform or a set of guidelines that should lead towards developing in-country investment. And these guidelines start with the assessment. You see, the first step towards developing a well-integrated digital health investment would be to start with an assessment of the ecosystem, assessment of the emerging of the enabling environments. And this is actually what our team also conducted. Started with during the pandemic. So what happened is that we were receiving also a lot of requests from not only from our ministry but from our GIZ internal programs towards understanding the needs in the partner countries around digital health in the pandemic context, and we didn't identify in the whole range of tools that are available. We were not able to identify tools that is open source and available for the assessment process. So in this line, the GIZ developed together with GFR, and Peter was the lead consultant on that. The DPPA tool, which is the Digital Pandemic Preparedness Assessment Toolkit. It's a public good, and we conducted a pilot assessment in 5 ECOWAS countries. And as I said before, the toolkit is a public good, and it's offered, it's a set of Excel sheet that offers a systematic methodology to assess a country ecosystem and the existing toolkits and identify suitable toolkits that can be adapted or implemented in the country context to respond to the pandemic, COVID-19 pandemic. So, but it offers a more generic way of assessing it so that it can be adapted to other pandemic also. Okay, this is so far for the assessment toolkit. Maybe we can go you can go to the next page. So the assessment toolkit has these are the use cases that the assessment toolkit has integrated. So these use cases have been developed in line with the map and match project from the USAID. It's offers actually a baseline database on toolkits that are available in specific country and can be very fast adapted in a context, and these toolkits are responding to specific use cases, and as part of the work we did was to align them with these use cases that have been developed in the map and match context, and I believe these use cases also are in line with the WHO digital health intervention, as map and match is currently sitting on the back of a WHO platform or inventory of digital health tools. So these are the DPPA use cases that we used. We have 14, we defined 14 categories, which are or broken down into 64 functionalities. And those functionalities are actually the functionalities that describe how a toolkit should respond to a country needs during a pandemic. So you can go to the next stage. To the next page, sorry. And this is actually the workflow that we defined for the pandemic preparedness assessment. And the first workflow, as you can see, we're defining a set of 3 work packages. So, and these 3 work packages actually were supposed to be conducted within 4 weeks. So, and in the reality, we needed to adapt this workflow because of a lot of emerging challenges. I will go through the challenges right now, but or after this slide. But basically, we needed to adapt the workflow to be able to produce the results that we needed to complete the pilot phase. So from these 3 big workflows steps, we went into formulating work packages for our consultant to be able to move. So, and we needed to limit also the range of assessment, because if you are assessing a country ecosystem, you have different level of tools that you need to look at. You need to look at tools that are being used at national system, at regional, at national level, sorry, at regional level, or at individual level. And we decided to go for an assessment at national level. We didn't look at further level in the system, in the ecosystem, because it just was taking a lot of time. So these 5 work packages were country assessment, country engagement. So this was a work package that was really fast, where we went really fast through, but I will give a bit more details on the challenges we had through each of the work packages. Yes, in the next slides. Okay, these are the challenges we had in the first work package that we defined. We were supposed to engage countries and explain the country, the purpose of the assessment. And it was a bit tough because you need, country need to understand why an assessment is being conducted for. And our goal was not to use the assessment for our own purpose, but also for the country to, the assessment should serve the country purpose. As we didn't see at that time the GIZ as being the only one partner for the countries to support, to be responsible for solving all the problems that could emerge during the pandemic. So it was tough to get the endorsement of the countries from the start. But we got from specific ministries endorsements, or from specific project endorsements. It was also tough to get a consultant and retain him or her, because in many countries, to assess the country context, the consultant needs to work very closely with the ministry. And in some countries, it was really difficult to bring in an external consultant in the country ministry context and conducting the assessment. So we had a lot of challenges with finding the right consultant. And during the pandemic, with the drop off of because of sicknesses, we had also some challenges with that. So in conducting the second work packages, we encounter difficulty to coordinate partner development partner works. Meanwhile, we were conducting the assessment. For example, in Sierra Leone, we had another development partner which who was also conducting the same assessment as we were doing. So for the ministry, it was also questionable. Why don't you align to your own principle, donor alignment principle, and you are doing a silo work? So this, we needed to adapt it in some few countries. Like in Ghana, we were able to align with the same development partner to avoid duplication. And we had also in many countries the issue of selecting the partner that we were interviewing, for example, in a specific ministry, were requesting more ownership than other partner in the same ministries. So it was a bit quite a burden to find the right interview partner and to stick with the responses of this partner. So because this should, I mean, the aim was to evaluate the results of this interview to become a self-assessment of the country, and then it was quite difficult. So, and the third work package was to conduct the inventory of the digital tools that are available in the country. What we did was to take the map and match database as a baseline and to validate against other existing baseline database in the countries. So in some countries, there were some few databases that the countries or the ministries were I mean, managing at national level. So we had in Togo, for example, we had in Togo several databases which were available at ministry level, but also at I think there was another institution that has also a database. So we needed to merge them and match them against our baseline database and conduct the validation at that level. And the fourth work package was to conduct this validation database that we had consolidated in the third work package against the use cases that the 64 functionalities that we defined in the as being pandemic preparedness functionalities. So validating those toolkit against the functionality was quite a huge challenge, because the functionality were not always straightforward. A toolkit was used for a specific use case were not as clear as we were thinking that it was clear when we were defining or formulating the toolkit. So in the country context, the use cases were differently interpreted than we were thinking. So, and for the fourth work package, we had a challenge to identify the right format. In some countries, for example, we had the request from the ministry to cost each single recommendation. So we did it in Ghana, for example. The consultant went ahead and costed each recommendation together with the ministry and prepared a dissemination workshop together with the ministry, and it has been really well acknowledged and well received. But in some other country, for example, the ministry didn't even want any costed, or they had a problem of endorsing the format of the recommendation. So it was quite a huge work to compare the country results. Okay, we can go to the next stage. Okay, these are the lessons learned, and after that, I think Peter, you can come in. So I will try to keep it also short. The country, that's in short what we did during the assessment, and what did we learn from these 5 work packages we formulated. So when we try to engage the countries, we had okay, the country engagement. We learned that it's important to seek the feedback from the local consultant and local development partner. As I said before, we had a development partner conducting duplicated assessment in a specific country, but there were no chance for us to identify that all these working stream if our consultant were not the one giving us this information. So it is crucial to have the country leading on the assessment. So, and what we also realized that it was not only one ministry which was responding to issues around digital health in the country. And when we were conducting pandemic preparedness, we were asked to engage another department than the one we were thinking that they were responsible for it. So it was quite a huge a huge learning to see that a country has different way of addressing digital health topics. So what we learned, or one learning would be that there is the need of a whole digital health unit that is involving not only the Ministry of Health, but other ministries or other departments in a country government to address digital health topics. And that the whole process need to be led by the country, by this digital health unit. The second set of learnings we had were around the country ecosystem. So we learned that in many countries there were a lot of different information about the country's digital health strategies. Many of the countries had digital health strategies, but the information was not in a centralized place. So and we end up realizing that many countries need a digital health strategy. If they have a digital health strategy, they needed to know about the it needed to be prominently known in the country that there is a digital health strategy. And some few countries requested for the development of a new digital health strategy because they were not aware of this digital health strategy. So the information needs to be also there, that there is that the digital health strategy are needed, and that this strategy is providing a framework to prioritize the country needs. We realized that there were emerging challenges that needed to be addressed. So we went into the countries with a pandemic as a one of challenge that we saw during the pandemic, during the crisis. But in some country, we realized that there were other pandemic, not only COVID, but we had other epidemic topic that were relevant in the countries. So it needs a multilateral or multi-sectorial approach to address emerging challenges in the country. So, and So there is the need of looking at a whole ecosystem in the partner countries. So the third set of learning we had were around knowledge management. Like I said before, there were no centralized, in some countries, the lack of a centralized inventory place where we could have access to all the information, learnings were missing. So they need a up-to-date, and then there is the need of an up-to-date knowledge management at global, at local, national, regional, and global level in selected countries. And there is the need for these learnings that are being generated to be centralized in this knowledge management or platform that are created. So either they need to be created, or if they are there, they need to be updated. And we have the example of the Digital Health Atlas, which is prominently, which is widely known in all the countries. But the issues around the Digital Health Atlas was that it was not up to date. So there are a lot of effort from the WHO to update this repository, but this was an example what we really brought in many times that we are encouraging into. Also, the fourth step of use cases were around the fourth step set of learnings were around the use cases that we defined in the pandemic context. So we defined these 14 categories with the 64 functionalities, but we realized that pandemic, as I said, was not only the one aspect that were mostly relevant for a pandemic response process in the country. So there were a lot of use cases that we needed to adapt or to redefine with the consultant or in the country context to allow the assessment process to be finalized. So we think that there is a lot of work, learning that we gathered around these use cases, and we think that this need to be a process that should be defined not only based on global standard, but also locally. The local perspective or the national perspective should be reflected in the definition of the use cases. The last learnings we had were around the recommendation. We need the recommendation that are being formulated, like I said, were not only for to inform GIZ project, but the aim was to coordinate within some working group with other partner to respond to the country needs together on specific, aspect. But countries can address, we realized that some of the learning recommendation we had formulated were also recommendation that the country could have addressed by themselves, but not only. So donor support is needed, but we think that it's needed to be coordinated better. And capacity building networks. So for all the tools that we identify as valuable as countries that or tools that need to be leveraged, there was the need of finding a community around these tools for the implementation, for the usage, for health worker, and also for the maintenance. So this was a huge learning that we also had in this last process. So, and all those learnings we didn't want just to formulate packages of learnings, but a learning can become sustainable if it's being adapted in a cycle way. So it means that we have those learning, we implement them, and then we have the chance to make mistake again and to adapt those mistakes again. So this is why we package those learning in a cycle-based process, and this is why we would like to discuss this process with you. And I will hand over to Peter to show how we put those learnings in a framework.
Thank you, Barakisa. Just let me see if I can share my screen. Can everybody see that?
Yeah, but not in the presenting. Yeah, that's good.
Is that okay?
Yes.
Okay, very good. Thanks, Barakisa. So my name is Peter Drury, as was said earlier on, a consultant who's been very fortunate to be helping with the digital pandemic preparedness assessment, as well as doing some work to support the African Union on their digital health strategy. And the opening point here kind of connects with what Barakisa has been saying, in particular, the point that she made about work package 4, one of the lessons being that digital pandemic preparedness is just one aspect of a digital health system. And digital health systems are certainly complex and adaptive and open systems. They keep changing. People keep doing good things to respond to different crises that come along. That's how they are, how they work. And for us, the opportunity that such a huge shock to the system as the COVID-19 pandemic presents has been to kind of think, okay, so how can we respond better in the future? And think about that, not just from the point of view of a pandemic, but from the point of view of how do we help our digital health systems become more resilient? So first point, essentially, digital health systems are complex. And of course, they have different sectors. And you can see from this pie chart that in Kenya, for example, there's a pretty even split between the public sector and the private sector, with also the NGOs and faith communities playing their part. So health systems are complex at that level, but of course they also consist of hierarchies. So you've got care going from the tertiary to the primary level, and within that, of course, there are many different specialties. So it's fair to say that health systems are complex and adaptive systems. But increasingly, we're finding, and I've certainly come across this doing work in Vietnam recently, that there are other sectors that are engaged in responding to challenges that are relevant to health. So this includes education, agriculture, the environment, technology, e-government, home affairs, rural development, for example. These are other sectors that are involved in responding, for example, to the One Health challenges that we face. But increasingly, as UNICEF will testify, for example, understanding the educational impacts on health is also really important, and the way in which technology can support better health education in communities, for example, it has got an important role to play in improving the functioning of the digital health system. And there are also a number of stages in responding to whatever the issue in question is. So as we were saying, in our case, we kind of came at this from the point of view of a pandemic. But essentially, there are 4 stages, four stages that you can discern in responding to whatever the issue is. How do we respond to it? What systems and standards do we actually implement? What do we learn from their use? And how do we plan to improve things in the future? it's pretty straightforward and common sense, but we often get lost in and overcomplicate things. But essentially, those are the four major things that we've really got to be concerned about. So how well did we respond to whatever the issue was? Can we improve how we implement our solutions? What do we actually learn about our strategic requirements in the longer term? And then what should our planning frameworks be? So this is essentially the cycle, but underpinning it, there are some foundational issues, and I've picked out three key ones, absolutely key ones. So whatever we do, essentially, we're not going to get far in improving digital health unless we're addressing the issues of connectivity, unless we're addressing the issues of improving the capacity, the skills of people, whether they are health professionals, whether they're digital health professionals, or indeed if they are members of the public and patients, to be able to use the tools and technology and the knowledge that can be conveyed by using it well. And of course, whilst that is very powerful, it also needs to be well governed. So underpinning everything that we say we're talking about here, connectivity, capacity, and governance are three foundational issues that we need to bear in mind as we proceed. But I put this in red because I think this is fundamentally the issue that we're trying to address. So the digital health system cycle is intended to be a framework to help prompt constructive questions about the functioning of the digital health ecosystem. So it's a very broad statement, but what I hope to be able to do is to illustrate what that might mean in practice. So let me just unpack that a little bit. So I've already explained that we've got the responding, the implementing, the learning, and the planning going on, and this is happening within and between the different sectors that make up the overall health system of any country. So at the core of it is a Ministry of Health plus. So this is essentially saying there are some policymakers at a central level. They may be only within the Ministry of Health, or there may very well be other important national level health institutes that also have policy advice and expertise to make available. So it's a broadly construed Ministry of Health, but essentially they're the people at the center of this cycle. And what we have to do is to frame a response to whatever the issue is at hand. So I've just illustrated some of the ones that exemplify this. So One Health, I've already mentioned. Pandemic was what we were discussing earlier with Barakisa. Blockchain technology, for example. Smart Africa have just released a very neat white paper on that topic. Social protection, hugely important in many parts of health systems around the world. Supply chain issues, for example. Whatever it is, there are issues, and the challenge is how are they responded to, both by the country and its partners, development and technology partners. Then we need to understand, okay, so we implement whatever we think the appropriate response is, what do we learn from it? And that knowledge management happens at a personal level, at a local level, national, regional, and global. And some of the issues that we are concerned with will be pitched at a national level. But we recognise, and Barakisa mentioned this, that actually within a country, the way in which people respond to the challenges of digital health, say, for example, with the pandemic, will vary. We didn't focus on that in the DPPA, but we recognise that that in reality is a major challenge. How do regions and districts within a country develop their own systems? How do people at a local level manage the knowledge that they need to have about how to respond to challenges such as COVID, for example? Academia and research have a huge amount to offer and contribute, so that collectively there are lessons to be learned. And the other point underpinning this is that over time, a learning culture can emerge, and they can be characterized in many different ways. But essentially, being open to criticism, learning what works well, sharing that knowledge, and encouraging improvements and excellence is what a positive learning culture is likely to be meaning. And that then leads into better informed plans and ways in which we update the strategy. But sitting around and articulating the relationships are relevant digital networks. And there are a number of these. Health Data Collaborative is one, but there are many others. So depending on the issue and the nature of it, what is relevant will vary, but they have a very important role to play in helping articulate everything that is going on. At the center of this web is something that, for sake of convenience, I've called a digital health unit. Essentially, this is where the responsibility and the expertise needs to lie to ensure that all these interrelationships are well articulated. And part of the problem that we had with the DPPA assessment was that most of the countries that we were working with did not have, at a national level, a digital health unit that knew already what systems there were operational in the country, what the structure of the health services actually was, where people were, what the local health challenges were, what the relationships with the partners also could be, was very difficult and had to, in a sense, be constructed. So the lack of any focus really makes it very difficult to do what needs to be done to improve the overall functioning of a digital health system. So just to summarize then, I just wanted to say that we identified, as a result of the learning processes that we went through, that we need to have one at the center, a digital health unit that works in close relationship with the major policymakers based around a Ministry of Health, that we need to be able to respond to issues. That's number two, that we've got a concern about implementing systems and standards. Number three, there's the learning that needs to go on and the planning, and our sitting to help make all these connections are the relevant digital health networks. So that's it. That's the digital health system cycle in general terms, but I wanted to give an example now. And the fact that some of you were not able to see some of the slides that Barakisa shared in the first part of this session is not catastrophic, because I'm actually going to use them here to illustrate what this cycle might mean in the context of the Health Data Collaborative. So the Health Data Collaborative has got working groups focusing on these particular issues, CRVS, community data, etc. So these are the ones that have been identified. Great, all very commendable in my view, certainly. So those are where the working groups are doing their work, and to do that, they engage with partners and the relevant digital health networks. So that's the second part of the three areas of focus that the HDC has. And then the third challenge is actually the knowledge hub. This is the third part of HDC's contribution. So in the knowledge hub, over time, you are bringing together, developing, storing, making available guidelines, indicators, standards, survey tools, resource kits, etc. Great. the constructive suggestions, at least I hope that they are constructive, that come from thinking about what is being done, in this case by HDC with respect to this model, is to ask ourselves, okay, so how do we know how are the standards actually being implemented in practice? What are people actually doing on the ground to implement them? What do we know about that? How are they being incorporated in practice, in national plans and guidance? How might they be incorporated in the solutions that technology partners, for example, might be offering? So those are just to illustrate some of the questions that, looking at, in this case, what HDC does with respect to this overall cycle, says, well, to come up with a more holistic understanding of what we're trying to do in improving the digital health system. This is what HDC is currently doing. Are these questions worth posing and getting answered so that we understand the overall picture a bit more completely? So that's just an illustration from the HDC. If we take as another example, digital public goods, we might well be asking questions like, this is a country speaking in a sense, given whatever the challenge or the issue is there a DPG that we can use to help us get around these problems? Great. Can we compare different implementation approaches? What's worked well in a country like ours or in a district or region like ours? Are digital health information working groups or health information networks actually able to support us in using a DPG or a range of DPGs? Are our relationships with them working well? Are the ways in which the DPG is classified and their functionality, is that dynamic? Is that reflecting the changes in what's happening, or are they all a bit out of date? What actually is our Ministry of Health's current policy? What will its future policy to be? And indeed, what is the guidance on the use of DPGs? So you can just see that if you take a topic such as digital public goods, the model at least helps you ask some questions, and they may well be well answered in many respects, but there may be some issues that it's worth flagging up and getting some more thought given to resolving the issue that has been raised. So the last example that I wanted to share goes back to a point that Barakisa was making, that the WHO, Derek Manini and colleagues are looking at having revamping, revising, bringing up to date the repository of digital health strategies. So what might be the issues or the questions that we would suggest that this model might pose that would be of relevance to the WHO? So from their point of view, the virtue of having a repository is not to have that is the main thing in its own right. It's essentially to help countries take better decisions. So how can we develop a digital health strategy, a country might ask, that can benefit from guidance that's being used, including the digital health systems strategies of others? What current guidance, including from the repository, supports strategy development? And Barakisa shared the DIG diagram that indicates there's plenty of material out there that provides support and guidance for different aspects of developing digital health strategies. But a repository is certainly a valuable source, I think. So what are the lessons that can be learned about the use of the old repository, and how does it fit? How does any new one best fit within what is now a different environment where there is much more guidance available? How do we make sure that the opportunities to recognise some synergies are flagged up, and that we don't do things that are already now being done elsewhere. An important one here, I think, is what improves the use of the repository by digital health information networks and development partners. What is it that we can do to help galvanize the interplay between what goes on within a country and, in this case, the people who will be storing the output, the digital strategies in the WHO? What would encourage two-way use of the repository? At the moment, what is it that countries are actually going to get out of it? And what are the incentives for them to contribute what they've done to any new repository? Well, part of that issue may be to do with funding, support and guidance on using and contributing to the repository. And then the last point, which comes from the outer circle of context, what about the strategies of other sectors? So it's great to have an understanding of the digital health strategies, but actually increasingly health is being understood, or digital health is being understood as an aspect of digital strategies that countries are developing. So what about the other strategies from other sectors and ministries of ICT? So briefly, how do we push all this together? I wanted to just share with you the idea that actually what we're talking about is a flotilla. Now, this is an analogy where you have a group of warships with a mixture of different types, so they can be long-lasting. This is the definition that Quora has. What's the difference between a fleet, a flotilla, and a convoy? So what they said about flotillas was a mix of warships of different types. They can be long-lasting, operating together over a long period of time. To me, that sounds like a good way of describing what I think needs to be worked on here. So we've got, as ship number one, in a sense, the Ministry of Health. We've got a responding ship, an implementing ship, learning, planning, and networking. And at the end of the day, what we're really looking to answer is what might encourage a structured approach to help a country engagement with all the major components. What would be appropriate? So, for example, if we take the mothership, in a sense, the Ministry of Health, what would it take? What does it take to provide the overall coordination and guidance? That's their primary role. How can we help them do it better? How about coordination of the digital health related work of the Ministry of Health with other relevant sectors? Education, ICT, I've mentioned already. How can digital health units coordinate, interpret and deliver the right signals and policies and guidance to the rest of the health system and make good recommendations about digital health standards, investments and procurements? And how can things be coordinated, not just so that there's good knowledge of what's going on within the public sector, but also the private and faith-based and NGO provided services? So that's just to illustrate some of the questions that may be relevant when we're thinking about the functionality of the mothership. If we think about the responding piece of the cycle, responding ship, how do the existing planning guidelines, for example, together with advice and guidance from the Ministry of Health, Development and Technology partners, how does it actually inform the response to an issue in question? In practice, when we were faced with COVID, what help was there from the Ministries of Health, Development and Technology partners to inform what an appropriate response was? For a given country and an issue of concern, what happened in detail from the point of view of digital health? How did we go about making things better? How was the response to the issue framed? And what were the lessons that were learned and what was fed back to the Ministry of Health? Just in summary, the other 4 ships issues to do with implementing. Okay? So how are the issues concerning standards, investment procurement, implementation, change management? etc. How are they being addressed? Similarly for learning, data, information and knowledge, storage, aggregation, retrieval, and a learning culture fostered. How do we know what best practices are and how are policies actually converted into good quality operational plans, and how are digital health strategies actually developed? And what does it take to create and maintain the digital health related country and regional networks that enable all these different components to interoperate? So these questions and this approach can be applied to any particular issue that may be of concern, whether that's a particular disease or a particular issue in question, whatever that happens to be. There are these processes that need to be asked and answered, remembering that sitting underneath all of this, there are the foundational issues, connectivity, capacity building, and governance. So my three questions I just wanted to leave you with before we open for Q&A. Is the model simple enough to describe a complex process, the complex processes that go on within any digital health system? Are there things that need to be added or simplified, subtracted? And what is the potential for institutionalization? So how do we make improvements of our digital health systems something that is going on all the time, so that best practice becomes part of the way we do things, not something that is done for a couple of months and then when the crisis is over, is forgotten? So those are the questions that we had, and I very much hope that we can have some good questions and answers as a result. Thank you.
Thank you very much, Peter and Barakisa, for giving us this overview and explaining a bit about the digital health system cycle. And I see already that somebody rose his hand. Moses Dlamini, I will hand over to you.
Moses, you can just unmute yourself. You have
Hi. Sorry, that was a mistake. It's fine.
Okay.
Sure.
But I see another hand, Daniel Osheng.
Hi, thank you. I want to thank the two presenters for a very wonderful work. I think that is quite informative. Two questions. The first one is on the issue of governance. I think this is to me that was one of the very key and very vital piece. To what extent did you find this a big problem in terms of the practicalities, both at strategic and operational level? That is the first question, especially for digital health. I'm speaking from digital health. And then the second one is, what, if any, did you find attitude to be an issue, especially when you talk about capacity building or even use of systems? Thank you.
All right, Keisha, do you want to deal with the governance question?
Can you hear me?
Yeah.
Okay. I mean, when we started conducting the assessment, it was key of, I mean, we needed to, I showed the country engagement part. It was to inform the ministries about what we wanted to do and to go through a set of country-led processes to ensure that we are not going to that we are adhering to the country processes. And in Nigeria, for example, we had the ministry didn't understand that the data that we were capturing in the context were not private data. I mean, that we were not going to capture data that were against the data health privacy that is defined in the country. So we needed to go through a set of discussion with the government to identify where are the limits of the assessment. So we were not going to conduct an assessment that will use privacy or to go against the data or the policies in the country. So I don't think that we had big issues at that level around. We were in line with what has been defined in each country context. So I think that I'm not sure whether I'm really going into whether your question is being responded in that sense, because country-led processes needs to be well discussed before engaging the country, and in that area, I think that we manage it well in each country context. So.
Thank you, but that was actually not my point. My point was more or less on the digital health cycle. To what extent do we find that issue of governance in where the digital health strategies, for example, exist, where issue of governance is a contributing factor to the success or otherwise of digital health initiatives, and whether this is a problem both at the strategic and operational level. What I mean is at the highest level of the management, and also at the lower levels where we have operational issues, or the implementation rather. That was actually what my question was all about. So
okay, so let me respond. Governance was one of the three foundational issues that I said underpin the whole of the operation of the cycle. So that means it's relevant both at the implementation level for a particular issue, whatever that happens to be, and at the same time, it's very relevant at a strategic policy level too, and obviously needs to be a key part of any digital health strategy, or at least pointed to as being a necessary condition to get right. So I think governance, together with capacity building and connectivity, are necessary conditions for anything really that's going to work by way of being a digital health solution, or a set of improvements that can be made to the operation of any health system, again, broadly construed. And in terms of the attitudes that there are, I think the attitudes have been changing now towards the importance of governance. I think if I just think back over my experiences, the issues of privacy really were only of great concern to a small number of people who had a particular anxiety around electronic medical records. But over time, of course, as information and data gathering have become bigger, so we now have big data, and the anxieties have increased. And I think the attitudes towards finding ways to improve the functioning of health systems, and in particular the governance of them, have changed and are now being taken much more seriously. That doesn't mean to say that they're working as well as they should be, but I think they are now being seriously considered, whereas 15, 20, 25 years ago, they weren't really crucial issues of concern. But now I think they are. So that has to be a good step forward. Thanks. Thanks, Daniel.
Three more hands up. Kwame, please ask your question.
Thank you very much. And I think thank you very much to the presenters. I think Barikizu mentioned quite a number of times. My name actually is Fred Kwame. I'm based off in Ghana, specifically in Kumasi, not in Accra. And so I was particularly interested in finding out if there was any revelation from the assessment as to the linkage between the existence of a framework at the ministry level for digital health interventions and how that translates into sort of the willingness, circling back to the earlier question of the health professionals to adapt a digital solution or intervention that is being introduced. I am saying this because in the organization I work with, City Cancer Challenge Foundation, we are introducing some digital solutions in the country. And yes, Barikis, we involved the Ministry of Health, Dr. Wisdom Atiwoto and his team directly in that, but that doesn't necessarily translate into on the ground level health professionals adhering to the usage of this digital intervention. So I wanted to see if there was a revelation in that light. Thank you.
I mean, this is exactly why we put these learnings together. There was in the countries we were conducting the assessment, that's exactly what we found. There is a lot of fragmentation. There is a lot of silo implementation, even though some, I mean, there are some institutions that have this. I mean, WHO has given a framework. The DIG, what we presented before, the digital health investment guideline is actually the widest or the best framework that is currently being published that should be used in the country to guide the. If you look at the DIC, it has a lot of aspect or toolkit or element or strategy policies that can guide a country at to conduct to implement the national plan. But in how far this is being adapted or how far the country is trained or the ministry is willing to implement that is something we were not able to see. So it was not implemented. I mean, the countries have the willingness to follow a certain strategy, but I mean, donors have also to align to their own principle to be able to use a single framework. And this is also one aspect that we encounter as a challenge there. So there is a lot of plenty of framework, but no single one which is converging towards the country needs. And we are defining country engagement in different words. We are defining, I mean, I've been asking this question many times in the Health Data Collaborative. How do you define country engagement? What is the successful country engagement for you? And there have been many responses to me. And this framework or this learning we had throughout the process was what we wanted to bring in together in a the cycle actually is the what is bringing in the sustainability, allowing the country to look at the range of framework that is available at global level and to decide on a platform, dedicated platform, how they would like to engage with their partner. Defining the digital health unit and deciding on to how they would like to go through certain steps of the cycle and to engage partners in that sense of the cycle, so to respond to the emerging issues. So we didn't find, I mean, I would say the DIC was one of the, but if you see the DIC is the one of implementation guidelines there, the cycle is currently missing I am missing this cycle. It's a one of process guideline of tools or principle that can be adapted by a country to develop their strategy, to implement their systems, but there is no recurrence there, and the learnings fact is missing. This is what, yes, I think I couldn't see one off framework that I would say, okay, that's the context where we were able to implement. I don't know. Sorry if I'm not really responding to your question. Maybe Peter, you can add on that.
I don't think I've got anything particularly to add on that, Barakisa. Thanks. But thanks for the question, Kwame, and Kumasi.
Right, then we can continue with the next questions. I see Teddy Hale and Rima Chaya. So Teddy, please go ahead with your question.
Thank you. My question here is actually what David kind of touched on, is that here in Ethiopia, we've removed a lot of the fragmentation from, like, I think close to 30 different systems into 3 to 4 systems that the Ministry of Health decided to agree to use as an implementation system of EMR systems. I'm sorry, I keep saying systems, but what I'm trying to say is, right now, a lot of the issues here is that some of the countries have lack of skills in terms of implementing these EMR systems that the donors are paying for. And also, there is no clear strategy on data hosting or data strategy, how to coordinate the different systems to interoperate within each other. That's one of the examples that we've developed, but we've deployed an EMR system at one of the hospitals, and they are hosting their own data in-house rather than putting it on the cloud, or either having it internally. So having these fragmented data storage idea, how do you, or what do you suggest for the Ministry of Health to figure out, like, how do you store data, and how do you come up with a data policy that actually worked for the country? One of the suggestions that I brought up is actually for the Ministry of Health to pay for its own data storage in-house, and the donors can actually either they can do in-house or like an Amazon cloud storage, where we would pay for the Amazon cloud storage, but then they would turn around and pay us in the local currency. So that way we still have money in-house, and they are paying for the services one way or another. So that's, I was wondering if you guys have thought about something like that. Okay, I'm done. Over.
Okay, thanks, Teddy. Let me make the initial responses. Good question. Good question. Going back to the cycle, the networking that I said kind of holds things together includes, though I didn't perhaps stress this sufficiently, includes not just what is going on within a country, but what is going on within a region around the country. ECOWAS was where we were working with the DPPA, but there, in the context of Africa, there are other regions, regional economic communities that are there. So it includes trying to understand what can we learn from our peer countries within our region, but it's also relevant to know what's going on at the AU level. And if I could just kind of share where things are. So the AU, the African Union, is working and has been working for a while on data management policies. And the Africa CDC, which produced its digital transformation strategy at the beginning of last month, March this year, is also looking at these issues. Smart Africa, which is a organization that brings together 36 heads of state and countries, and has strong relationships with the ministries of ICT, are also working on this area. So in a sense, my advice would be leverage the networks. You know, look outside the country that you're working in. Try and find the relevant health information network that can help you learn what works well elsewhere. What are the emerging policies coming out of the AU or practical guidance coming from Smart Africa? So, and indeed your peers within the region. So leverage the networks, I think, rather than try and just put the pressure on yourself by inventing things and coming up with what sound like very innovative and commendable solutions. But I would just reality check them elsewhere. And you may well find others who have done something similar and learned some lessons. Or everybody may say, no, that sounds really practical. Let's get together, and maybe together we can have an even more compelling proposition to put forward. So I hope that's helpful.
All right, we have time for one more last question. So Rima Shaya, please ask your question, be brief, and so we can have the answer. So because we have to wrap up in a couple of minutes.
Yeah, thank you so much. Basically, my question is, first of all, thank you for the presentation. It's a lot of information to digest. It's good to hear that the fragmentation is a problem all over. But I'm talking from the perspective of our context, where we are just in the beginning stages of planning for a digital health strategies. And my organization are supporting the Ministry of Health on conducting an assessment of currently existing digital solutions. Some of them are like general, if you wish, or globally adopted solutions, like, for example, the HIS2, while some of them are homemade in the context of the country. So my question will be, when you were talking about assessments, and you have mentioned several times standards. So for me, the question would be, in our assessment of the currently existing digital solutions, and in the development, because we're also supporting the government in developing other digital solutions that are non-existent. So what would be like the benchmark, or the, if you wish, a golden standard or a reference that we can go to in order to, if you wish, rate our existing digital solutions? So what will be the benchmark for the rating, and what will be the guidance for the development or new digital solution, I mean, new to the context? So is there a certain repository of reference solutions or guidances for what a solution should include, like the basic criteria that for it to be considered adequate to a certain level of the health system? Basically, this is my question, and please let me know if it is not clear. Over.
Let me just respond briefly, if I may, on that. It obviously depends very much on the specific nature of the systems that you're working on. I refer to my previous answer. Work the network. So I didn't mention them explicitly, but let me do so now. Helena, for example, in the context of Africa, AHIN in the context of Southeast Asia, are examples of information networks where either directly or indirectly knowledge is available about what's worked well and what isn't, and what the new developments are. So check them out.
Yeah.
And keep tight to work that is going on at CDC, Smart Africa, and I hope in due course at the AU itself in the context of Africa. I don't think that what you're trying to do has actually successfully been done in developed countries. I don't think that knowledge is there and easily available. Good questions, good intent, but flesh out what the networks are saying is currently a realistic objective.
But I think there are attempts from the WHO to bring up standards. You have these smart guidelines. You have also the digital, this DIG. I don't know whether you can just see, you can see it. It's a set of toolkit and standards. And then if you see the work that the WHO is doing around the smart guidelines is to trying to put in standards that can lead the development from paper-based to a different level, from paper-based to the system level to the full implementation system. And this standard should be something that could be that will be needed to be used to when replicating system in a country-based, I mean, ecosystem. And I mean, you have these digital public goods that Digital Square is promoting, but you have also the back end or the interoperability check, which is being done by WHO with their smart guidelines and the clearinghouse. I think there are a lot of toolkit there, but like Peter is saying, the networks have they have the relevant knowledge, which we also were pointing on in this framework. This is something that is missing. The learnings are not in these standards. We don't see it currently reflected in all those standards that are available. And those learnings are currently only stored in the network of practices.
Very good. Thanks,
Right.
everybody.
Thank you very much. I would hand over then to you, Carolina, to say the final remarks. But thank you everybody for joining in and contributing to this discussion.
I just
today.
wanted to add one thing. We are going to discuss further on this cycle in the country engagement working group, small working group. So feel free to join us in this working group because we are going to share more materials there.
Thank you, Ernesto. Thank you, Barakis and Peter. Teddy, I see you have your hand up, and I'm sorry we were out of time, but you can pop your question on the chat, and I've copied all the questions that we didn't have time to address, and I'll share them with GIZ, and then we can share the answers back with you. So to make sure everyone is contemplated by this webinar. So thank you for the wonderful presentations and for the discussions. Thank you all very much for engaging with your questions and attending this webinar. Webinars fulfill the knowledge brokering role of the HDC, and we encourage everyone who would like to present on a topic of interest related to health data to reach out to us via HDC Secretariat at who.int. We still have some spots available for this year. I think there are 2 spots available. So if you'd like to present on an HDC webinar, amplify any work that you've been doing, like just like our GIZ colleagues have done, please do reach out. And once again, thank you very much for having joined us today, and see you at the next webinar.
Thank you.
Thank you all. Thank you very much, Peter, Ernesto, Barakis, and to all your team at GIZ. Thank you.
Thank you. Goodbye.
Thank you. Bye.